Christmas. We wish you a Merry Christmas. We wish you a Merry Christmas and a Happy New Year. We wish you a Merry Christmas. We wish you a Merry Christmas. We wish you a Merry Christmas and a Happy New Year.
Well, we have about 2 weeks left in Affordable Care Act open enrollment, and I thought I'd share a story about receiving help and assistance in enrolling in the marketplace. I recently had a realtor friend post online that he was looking for a new navigator to help him enroll in the marketplace. So being the keen social marketer that I am, I went ahead and reached out to him and said, I would love to help you. But he declined my help. And the reason, and I'm paraphrasing here, but basically the reason he said was that he felt like a navigator was unbiased. There are many different ways to submit an application to the marketplace. You can go online yourself, marketplace.gov, log in, fill out the application, go through the whole process yourself, and not have any help at all. My advice would be to not do that, because if you make a small mistake, it could end up to a lot of time being spent fixing that small mistake. You could always call the Marketplace Center. There are Marketplace representatives that will answer the phone, that will ask the correct questions, fill out the application correctly, and enter your information, hit select or submit, and it's pretty much order taking. They aren't there to advise you. They aren't there to analyze your needs. They're just there to take your information in, submit it, and then tell you what options you have on the marketplace. Another option is a navigator or marketplace assistant, and there are about 5 things that these navigators, the duties that these navigators have. They're to perform public education and outreach activities, distribute fair and impartial enrollment information on health plans and the availability of federal subsidies, enrollment in qualified health plans, provide referrals to appropriate agencies for grievances or complaints, and provide all information in a manner that is linguistically and culturally appropriate for the consumer. So another option to submit an application to the marketplace would be to use a insurance agent or broker. Now, personally, I would advise that you use a independent insurance agent or broker that has multiple options through many carriers. Obviously, that's a biased opinion, but a reason why I chose to be where I am to provide that value that the independent agent can give. The value comes from we have existing relationships with our clients already, and we have existing relationships locally with our community, and we know what those needs are, and we know the products and have access to different products that can help those needs. We also have the experience with those carriers. We have long-term relationships with Blue Cross Blue Shield, United Healthcare, Aetna, that can allow us to show you different options across different carriers. Again, we work for you, and so we want to show you the choices from the different carriers. We're also not prohibited from advising you, giving you recommendations on what plan to take and what plan not to take, what company to use and what company not to use, because we can understand your needs. We can ask that question. We can see what or how you're going to use that policy, that plan for your own wellness, and we are able to give that recommendation, whether it be one carrier or another, or one plan or another. We're able to look at that need, that value, and advise you in a certain direction and allow you to choose what plan, what policy, what carrier gives you or your family the best value. Another thing is that we do have options outside the marketplace. Navigators and marketplace reps, they are solely, their sole purpose is to navigate you and assist you in completing a marketplace application. And for many of my clients, that's not the best option. And so having an independent agent allows you to look at options outside the box. The holidays are here, so I advise you today, before things get super busy, to find an independent insurance agent to advise you, educate you, and give you recommendations on a healthcare plan that'll give you and your family the best value in 2018.
Bring us a figgy pudding. Oh, bring us a figgy pudding. Oh, bring us a figgy pudding and a cup of good cheer. We won't go until we get some. We won't go until we get some. We won't go until we get some. So bring some out here.
The holidays are here. Things are about to get super busy. Busy. I can bet I got something in there.
We wish you a Merry Christmas.